So we're streaming to you live from the NH&MRC Centre for Research Excellence on Health Equity Research Retreat. And the first thing we'd like to do is acknowledge that we're meeting on the traditional lands of the Bungendore area, and pay respect to the elders past and present. And you're going to hear from a few members of our team about what we think about health equity.
Thanks, Fran. Now, we're just coming down here. Could you please introduce yourself? Tell us the burning health equity issue on your mind and your advice to policymakers.
Okay, so my name's Toby Freeman. I'm a researcher at the Southgate Institute at Flinders University. One of the health equity issues I'm concerned with is in a world where everything is moving online, digital health services and government services, that there is still a large amount of people who can't access online services. So my advice to governments would just be to ensure that you have face-to-face or other alternatives to support the inclusion of people who can't get online.
So we can't have health equity unless we have digital equity, is
Exactly.
that? Thank you very much. Hello, could you please introduce yourself?
Hi, I'm Aziz. I'm at the Southgate Institute for Health, Society and Equity, also with Toby at Flinders University. And my burning health equity issue is improving health outcomes for people from refugee and migrant backgrounds.
Okay, and do you have advice for policymakers in the wake of the Victorian election or in the lead up to the federal election?
I was really pleased to see the Victorian public reject attempts to demonise people from migrant and refugee backgrounds. I'd like to call on the Andrews second-term government to redouble their efforts to look at ways to support people resettling in Australia from migrant and refugee backgrounds, and this is a whole array of social determinants of health that are important for people. Things like having decent, affordable housing, pathways into education, including for people with temporary visas, employment opportunities that protect people from exploitation and discrimination but give decent wages, and access to health services that are well set up for them.
Thank you. Hello, could you please introduce yourself?
I'm Ron Labonte. I'm a professor at the University of Ottawa, and I'm part of this research group.
And what's the burning health equity matters on your mind?
That the world is increasingly inequitable, for which I have some advice, policy advice, to basically all governments of the world. And that is tax progressively and a lot, invest generously in social programs, regulate aggressively for health and environmental protection. All of us consume much, much less. And let's all remind our finance ministers that the only thing that continues to grow is actually cancer, and eventually it will kill us.
Thank you very much. Hello, could you please introduce yourself?
My name's Miriam Vandenberg and I'm a PhD student with Southgate Institute at Flinders University, but I'm based in Tasmania, so I study via distance.
Great, and what's the burning health equity issue on your mind?
The health issue on my mind is to do with jobs, as the mantra often goes. My particular research interest is in informal employment, and what I'm really interested in is that we need to look at adding the words fair and decent to the mantra jobs, because what we're seeing are enormous changes in the job market, in the job landscape market, and governments need to respond to that in a much more strategic way so that we can look at the health implications of this changing landscape of jobs market.
Thank you. Hello.
Hi, and I'm Fran. I'm director of the Southgate Institute. And the issue I'd like to talk to governments about is that when you think about who you're governing for, remember that you're governing for people's health, the environment's health, and not profit. And that's a really important message. Whether you're the Treasurer, whether you're the Health Minister, the Transport Minister, or the Housing Minister, think what is best for people. So putting people's health above profit. And I've just come back from the People's Health Assembly, and it was a very clear message there from people from around the world, from the 76 countries represented at the Assembly, that we want people's health, not profit, putting people's health above corporate interests.
Thanks, Fran. And just for those who may be joining us who may not be familiar with the concept of health equity, could you just give us a 101 of what is health equity and why does it matter?
Yeah, well, equity is about fairness. So if we say everyone's equal, we're saying they're the same. But when we say they're equitable, we're saying things need to be fair. So, for instance, Anna was talking about migrant health. Well, if you treated everyone exactly the same and yet you're a person who's just arrived in Australia, that's not going to be fair. It'll be the same but not fair. You have to give those people a leg up. So it's really all about the Australian notion of the fair go. How do we ensure that everyone has a chance to be able to live a flourishing life, and what supports do we need to give them to do that? And that's what's important about health equity. How will we end up with everybody having as good as health as they can by supporting them in those everyday conditions of their life? And as Rona's just said, by fair taxation, for instance, which means we can redistribute from the people who are very wealthy to the people who aren't so wealthy. And what we know at the moment is the opposite is happening. We're redistributing upwards. So the people at the very top are getting much, much more wealthier, and the people at the bottom are getting much less wealthier. That's clearly unfair. And what we need to do is sort of flatten that pyramid so that everybody is having a chance to live a good, healthy life.
Brilliant. So people can follow the discussions today and tomorrow and later in the week on #SDOH Future. Can you just give us a wrap of what's going to be happening today here?
Oh, today we're going to be looking in more detail at our research programs, and we've been sort of diving in deep to quite detailed research programs. But today we're going to say, what are the more general lessons that have come out of those? How can we advise policymakers about what all the research we do means, so that they can transfer that into practical policy recommendations?
Brilliant. And we'll do another Periscope tomorrow morning with everyone. So if everyone just like to stay there while I sign off, and I'll get you all in the final shot.